we are going to use botulinum toxin to gently relax her forehead and her crow's feet. And Marie, go ahead and raise your eyebrows hard. So she doesn't like that amount of movement in those lines. So we're putting an amount of botulinum toxin, which is essentially half the dose that I'd be using if she wanted to be frozen, because that's what she prefers. And now go ahead and smile really hard, and let's see the wrinkles of the crow's feet. And here we're using the routine dose, which is 4 units per spot. We're also going to put a tiny dose of 1 unit right in the middle of the lower lid that'll reduce some of the bunching. Because remember, the muscle, the orbicularis oculis muscle, goes all the way around. So when we relax this part will actually work harder, and she'd get sort of a little more bunching. So we're preemptively relaxing that part also, so she won't have that bunching. The botulinum toxin product that we're using today is called Jeuveau or NewTox. It's the newest kid on the block of botulinum toxin type A products. It considers itself to be essentially equivalent to brand name Botox, and we'll see what you think about it. I expect that you wouldn't know the difference. After we do these injections, we're going to remove the numbing ointment that's on her jawline and in the front and the back, and we're going to do a syringe of Radiesse, which is a calcium-based filler. It's a nice filler, especially for this area, so we're going to do that next, okay? But first, let's go to the botulinum toxin. I use 2 methods to give her comfort for this. One is this ice, and she'll let us know whether it's immediately or in a few seconds when that ice is giving her a brain freeze. And the other thing we're going to do that I've been doing now for more than 6 months is use this little vibrator device, and it's amazing the percentage of patients, which is nearly 100%, that say that this is a tremendous benefit. It's not just mental distraction, it's also, there's a theory of pain called the gate theory, which basically says you have a lot of fibers on the skin, but you don't have that many fibers leading to the brain. Go ahead and vibrate. So if you're occupying the nerve fibers sending vibration to the brain, you have less fibers going up to the brain that can say, hey, this hurts. So we'll see what she has to say, because she's had injections before, but never with the vibrator, right? Mm-hmm. How was that? Better?
Not that bad.
Not that bad. Well, I guess that's good, coming from someone who says she used to run out of the office when the doctor gave needles, right? Mm-hmm. So we saw a little blood there, so within 1/10 of a second there's pressure, so she won't get a bruise. And we keep moving along. Now this product will start to work in probably about 5 to 7 days. And for that reason also, we don't recommend doing a touch-up in less than about 10 days. Because you don't want to touch it up and add more while it's, not fully working, right? So we've done the botulinum toxin injection. Now we're going to accentuate what is already a very nice jawline, but make it just a little bit stronger. So we're looking at the angle of the lower jaw, the mandible, and this area here, which is very commonly a little bit sunken, and it is on her too. So those are the areas we're going to be trying to emphasize with the injections. We're going to be using a product called Radiesse, which is a calcium-based product. I'd say the filler I use the most is hyaluronic acid, but this is a very, very nice product in the jawline, and that's what we're going to be using today. Methods here. One is the direct puncture, which I'm doing right now, and I'm right on the bone and putting a little bit of filler there. You can see how it creates like a little ball, and then I go ahead and smooth that ball out. Now we're going to work and put a little bit more on the jawline, then we're going to come back there and go under the skin and do a little better, a little more. Okay. Now one interesting thing about Radiesse is that it grows a little bit over time. Collagen comes in, so you get more than what we call a 1-to-1 correction, so that means we don't overcorrect. because in a month from now there'll be a little bit more than I left. And I'm holding pressure so that she doesn't bruise. Watch out, I don't want to hit you in the face. Stay where you are.